From commander-in-chief to casting director? Jennifer Hudson and Amy Poehler among the celebs hanging out of the White House yesterday as President Obama hopes to give Hollywood a starring role in his latest healthcare push. But with more people growing pessimistic about the law, can Hollywood really help? Christian Dorsey says yes, Hollywood can. But Hadley Heath says no, they can't. Hadley Heath, to you first. I put it to you that using celebrities worked before, especially during the election. Why won't it work again with healthcare?
Well, it's clear that these celebrities have a real coolness factor, and the hope is that they will influence young adults especially, who are necessary to buy into the system to make it work. But sadly, it's going to take a lot more of an effort to get these young adults to spend thousands of dollars on overpriced health insurance. It's much easier for Hollywood to convince them to go to the polls and cast a ballot. Buying health insurance is another matter altogether.
Christian Dorsey, I think Hadley's got a point there. The celebrities, they've got to convince young people who are healthy and who don't want health insurance to go out and buy it or go out and get a subsidy. That's going to be a pretty tall order even for celebrities, isn't it?
Well, certainly celebrities are not going to be able to actually force someone to buy health insurance, but that's not the aim here. The aim here is that they're going to reach those people who are otherwise not engaged in even knowing about the health care law and the options that are available to them. And in that sense, I think the celebrities can be uniquely effective in a very cost-effective manner. Think about it. There are lots of ways to do outreach, and most of them cost money. What the White House is doing is leveraging the free impact of celebrities and their social media channels to do something that is very cost-effective and I think is going to succeed more wildly than anything that the Health and Human Services could come up with as far as outreach
Christian,
is concerned.
I got to say I'm a little suspicious. Sounds to me like the celebrities are going to be persuading young people to go get a subsidy, anchoring them to a handout. They're going to be doing that, aren't they?
It's not anchoring them to a handout, Stuart. It's actually just providing the means for young people to actually take care of themselves and also to shore up our health care system, which, even if you don't believe the Affordable Care Act is the solution, is in bad need of reform. So this is not a matter of keeping young people dependent. It's actually giving them more control over their lives so that they're not consumed by catastrophic debt from medical emergencies that do arise.
Hadley, go ahead.
Maybe it is cost-effective to have Hollywood stars tout the healthcare law, but what's not cost-effective is HHS spending multi-million-dollar contracts on PR efforts to try to promote the healthcare law at large. And I do hope that young adults find out what their options are and do some research about what's actually in the law, because 4 out of 5 young adults who buy their own health insurance are going to see that even taking subsidies into account, their premiums will be higher next year. So it really comes down to economic incentives. It's not about being cool and doing what Hollywood stars say to do. It's about our pocketbooks.
Tell me about this cool factor, Hadley. You think that Obamacare can become cool if it's promoted by celebrities?
I don't think so. I don't think anyone's going to think it's cool to shell out tons of dollars, basically to socialize the cost of health insurance, which for decades in this country has not been about really diversifying our risk or preparing for a catastrophic event. It's now about taking money from young and healthy people and distributing it among a system that's just very, very inefficient, tons of waste, and a third-party payer, along with Medicare and Medicaid. Many parties are paying into the system, and we're getting a much lower value compared to cost than we could have if we had a freer market in health insurance and in health care.
Okay, Christian, tell me, who is your most effective celebrity who's going to push for health care?
Well, you know, I'm seeing Oprah on the list. I think that's going to be hugely effective. I think you're looking at other people who are wildly popular: Eva Longoria, Amy Poehler, Will Ferrell. All of these people have unique channels into the young demographic, and through their reach, I think you could see promotion of the health care law, advising people of what's there. It could be phenomenal. It could be tremendous.
I'm inclined to agree with you. I think Hollywood is probably the president's best asset at this moment. Hadley, I'll give you the last word. You want to take me on that one?
Oh, no, I don't think it's going to work. Look, this looks like a desperate attempt from the White House to make a law that's so unpopular popular. If the Obamacare law was likable for young adults or for anyone, they wouldn't have to spend millions of dollars on PR, try to enlist moms groups, or try to enlist Hollywood stars to get young adults interested. If it were a good law, people would be interested in it in the first place.
Well, it's sure going to be interesting. See how this thing turns out. Christian Dorsey, Hadley Heath, both of you, thank you very much indeed. Good to see you.
Thank you.
Thanks, Stuart.
Can't pay for your kids' college?